Tonight, doctors, nurses, and medical students making a desperate plea to Governor Brian Kemp to expand Medicaid. Hope Ford joins us at AMC. And Hope, sounds like these medical professionals say Medicaid expansion would help them take care of the sickest and most low-income patients, right?
Yeah, absolutely. And a lot of these doctors and nurses, they work at Grady Hospital and they detail long wait times, performing procedures on patients in hallways and being forced to admit patients who can't afford outpatient care. Now, they say that the state is already paying for a lack of Medicaid expansion and they fear it will get worse once AMC closes. Medical professionals take an oath, take care of any and everyone. But now there's concern when any and everyone can't afford medical care and a large hospital is turning off the lights.
We are overflooding an already drowning system.
For 40 minutes, doctors, residents, and nurses detailed the difficult decisions hospitals like Grady make, patients being diverted.
We have to tell our ambulances, please go somewhere else. There's nowhere else to go.
Lack of space.
You walk down the hallways of the emergency room, there are patients sleeping in cots outside of rooms because we don't have enough rooms. Bleeding, we're performing procedures for them in the hallways because we don't have space.
Inabilities to afford much-needed prescriptions.
He didn't have Medicaid. He could not afford his medication.
Forced hospital admissions because a patient can't afford outpatient care.
There was a homeless man who was run over at night, came to us and had a complex leg operation. And he needed special wound care equipment. But of course he couldn't afford it, so we were left to admit him to the hospital.
What's the fix? These medical professionals say expand Medicaid.
We can skip all the hospital bailouts, we can skip the hospital closures, and we can get people the care they need.
WellStars said Medicaid expansion would have helped, but overall wouldn't have changed the final outcome to close AMC. Governor Kemp's already announced a plan to provide $130 million to Grady to help offset costs and build 200 more beds. But these 20-plus medical professionals say it's not the first and may not be the last time they've stood in front of Grady
and demanded that our patients receive the care that they need, and they need to have Medicaid insurance in order to do that.
Now, these medical professionals, they're not speaking in any official capacity for Grady Hospital, but they have said wait times are already exceeding 10 hours plus, and they worry that once AMC closes, those patients will just sit in the hospital as their symptoms get worse before anyone can see them.